Hello, everyone. Welcome to another panel of Competing in the Age of Business Ecosystems. Now we are going to talk about healthcare. How is business ecosystem in healthcare? I have three key people here, three amazing people here. Claus Jensen, the Chief Innovation Officer of Teladoc Health. Sukanya Soderland, Chief Strategy Officer of Blue Cross Blue Shield of Massachusetts. And Lieke van Kerkhoven from Flow2, where she is a co-founder. So I will start here with a broad question, and I will go one by one with you. I mean, healthcare always play in the ecosystems. I mean, I have no question about that. You have like the payors, the providers, the regulators. The point is, it looks like nobody or few companies try to leverage that intentionally. At the end, you have like pretty much like the way that any company plays in any other ecosystem. But it looks like there's an opportunity here, and I would like to start in this area. What is the opportunity? And what is this different from the traditional, I would say, competing with another one? Like the traditional way of playing in this field. So I will start with you, Klaus, and after you, we can go to the other guests here.
It's a fascinating question. I think the answer relies in part in the very nature of healthcare. If you think about the last couple of 100 years, right, we have become much more capable. In healthcare, that means specialization. And really specialization drives and has driven for at least a century fragmentation. So as we became more specialized, it wasn't just that, some organizations became payors to manage the payment and the risk. Some organizations continued to be providers. Employers started taking a role. There are lots of categories of players that have different roles to play, but those are inside the categories. There was specialization. Payers specialize in certain products. Providers, huge specialization in terms of exactly what conditions you're going to go after. And I spent 2 years working for Memorial Sloan Kettering Cancer Center. So that's a highly specialized institution that just deals with cancer. So 100 years of specialization and fragmentation. It's a highly complex scenario. There are ecosystem structures around the flow of financials. Sometimes you call them clients, right? There's a whole ecosystem of providers, and there are different roles to play, even on the health consumer side, the people that need care. As long as you continue down the path of we're trying to be more capable, you will continue to have specialization and fragmentation. What's required to do something in addition to that is a decision. I think most institutions have so far been so focused on becoming more capable and less focused on answering the following question: is there a role to play to amplify the larger healthcare value? So you're taking on a different role, which is beginning to organize, orchestrate, and amplify the system as it is. Most discussions around healthcare is it's broken, I need to replace it. Replacing doesn't actually fix the problem. You need institutions to step up and take on a different role. I think it's happening because as we had to live through the last 2 years and as we had to embrace a hybrid care model, some of the barriers broke, and there's now a real opportunity for an institution, for a company to step up and be an amplifier instead of be a disruptor that just wants to replace a part of the system.
Oh, I love that. I mean, one sensation that I have, and I will go to Sukanya, is that everybody wants to be the orchestrator, not the node. I mean, just kidding here, but you see that a lot, many with the big players. So, but Sukanya, what's your take on this? I mean, what's the opportunity here?
Yeah, it's a great question, Claudio. The opportunity is to move the market and the industry from one that has been focused on sick care to one that is improving people's health. And that requires moving from the break fix to working upstream and understanding how people live their lives and being able to influence them and their choices in ways that help them make healthier decisions that improve their health. We know that lifestyle factors, the choices people make in terms of what they eat and how much they drink and whether they exercise and whether they take their medications if they have some type of chronic disease, how they manage their stress, have a material impact. Some say upwards of 70% of the healthcare cost dollar is attributed to those lifestyle factors. And what we have now is an opportunity is to be able to find ways in which we can understand and influence the behavioral motivational profiles of individuals and interact with them and offer up interventions that may help them make healthier decisions. So then the opportunity really is about going from what is now, for example, the US market, call it a $3.5 trillion marketplace, which is primarily sick care, to one that is about greater health, which could easily be double that. And on the point that Claus raised relative to specialization and such, I think that's a fascinating concept. We have indeed seen a lot of specialization. And if I follow, Clay Christensen's theory, he would suggest that when industries are more nascent, they are more integrated. And then as they become more sophisticated, they become more specialized, and you have, different roles to play. And I think the point that we're at now in healthcare is one where we've gone through the arc that Claus referenced. We have a lot of sophistication and a lot of bifurcation, and we're entering into a new era. I think we're at an inflection point where there's going to be a desire to integrate and pull more together because there's too much point solution fatigue. And there's also less of an opportunity now for us to access all the benefits of what's out there because there's just frankly so much and the incentives aren't aligned. So the opportunity, I think, really is to try to bring that all together, which is why, to your point, so many people are angling to become the orchestrator.
No, I love that. Yes, I think you comment 2 points. That is how to bring more health. When you see some countries, and I think the COVID make that much more visible, how vulnerable like some health ecosystems were in some countries. Like look, US already had like chronic diseases only increasing along the time, and I mean COVID came and showed like how terrible was the situation of that. Now we can see that. My question that will come to Lieke is. Okay, there's a great opportunity here. What we need to do, I mean, maybe Lieke, you could answer as well what the opportunity in your point of view, if it corroborates with like Claus and Sukanya saying, but what is the change here for companies? What they need to change in order to be successful in playing ecosystems that they are not doing yet, or few of them are doing?
Yeah, I think the main issue we are dealing with is the mindset. So we can think of all these rational structures and new products, business models, laws. These are all the outside. They are all the tangible aspect, what I like to call, of something that is happening inside. And this inside, unfortunately, is an aspect we tend to ignore in many of the greater goals we try to achieve, whether that's reducing poverty, increasing equality, more circular economy, or more inclusive ecosystems. If we keep thinking like we've always done in the linear economy, so which means that we always need more and we need to grow, then we will always keep on the same track. So if we don't change that, if we don't become aware of the thoughts that are driving us, and also the ways we rate success or how we approve our employees, for example, then nothing is going to change, because then you keep coming with new solutions, but you'll be like a toddler trying to get that little square peg to fit the round hole. It will never fit because you're trying new solutions to fit your old system, and it's always going to give you friction. So we need to, and I call that a quest for more consciousness, because if we go inside, and I like to speak about the word spiritual development, and I know it's kind of a sensitive topic for some people, but by that I don't mean religion. I mean letting go of traditional thought systems, conventions, returning to ourselves and re-evaluating how we view ourselves, but also how we view our relationship to other people and the environment we operate in. And if we do that, it's a personal process for everyone in themselves, but only then I think you can come out again in a new way and really change something from the fundament.
Yes, I like that. I mean, Claus, I mean, the Teladoc is a pioneer in the field. So it have been trying, it have been successful in some areas, in establish like new standards. but it's also trying like new other ventures and new other ways to take care of, to tackle healthcare. So how is your experience with that? I mean, what is the mindset? What is the main challenge in changing this mindset that Lieke is suggesting?
I think it's exactly right, Lieke, as you said, that it's a mindset shift. I mean, you really have to redefine the problem. And that was why my first comment started where it did, because the problem so far has been become more capable. As Sukanya just said, the problem is changing. Now we also need to figure out how to do a better job of integration. If you ask people what they want a whole person health experience. And it's not even just about shifting from sick care to health care. That's important, but it's about the whole person. And if you think about the whole person, that's everything from primary care to chronic condition management to mental health to whatever other specialty needs that you have. And to an individual, it's one problem. So if you look at the whole premise for why Teladoc Health exists, is to solve that problem, right? It's to give people a different whole health experience. It's just that it's a hard problem. And it requires a couple of paradigm shifts. The first paradigm shift is the obvious one, which is we need to acknowledge that care happens in different settings. It certainly happens in different physical locations. There's certainly someone that's local, someone that's not, but it also could happen virtually. And for some things, virtual is a really good model. For other things, it's not. So you have this whole space of, okay, we have acknowledged that care happens in different places. We also need to acknowledge that whole person health means whole person orchestration, whole person amplification, actually trying to make the system better, not replace it. The reason that's a hard problem is two-dimensional. The one dimension is you actually have to sell your value proposition 3 times. If you want to become an aggregator, I like the word amplifier, actually, more than aggregator, because it's making everybody's impact better. It's not just about aggregating. You need to sell 3 times. You need to sell it to the payer part of the ecosystem, because if they don't want to pay for it, it's not going to happen. You need to sell it to the provider part. If the providers don't like the solution, if they don't adopt it, it's not happening. And you need to sell it to the health consumer, the people that need care. So if you look at every other industry that has successful ecosystem platforms, there isn't one in healthcare because it's just more complicated. You have different components and you actually have to sell to all 3. I think it requires a fundamental shift in the thought model. That was where Lieke went, not just in terms of the problem, but also in terms of how you go about solving it. Let's start enumerating the sciences that you need to address the problem I just described. If you actually want to deliver amplified whole person health, and yes, that is what we're trying to do, you need 5 sciences. You need clinical science because it's got to work, and it has to be rooted in what is clinically the right thing to do for an individual. You certainly need technology science because it's a matter of how you reach people, how you put the pieces together, how you integrate, how you meet people where they are with the right mode of care for the right things. And you think, okay, 2 is enough. I can actually count 3 more. There's logistics. It's a really complicated ecosystem. And if you're not good at logistics, it's hard. Millions of pairings of patients and providers every year in a virtual setting. We got to make sure that the provider is licensed in the right state, that they have the right kind of background for what it is that the person wants, get help with. It's a complex problem. And we are not even talking about all the devices that are there. There are hundreds of millions of devices that harvest really interesting data points, right, from a health record perspective. How do you even get at it? And how do you break down the barriers between the different healthcare institutions, start putting the data together? So logistics, really important. I'm not done. You can add one more, behavioral science. Both Sukanya and Lieke talked about the fact that how people behave has a huge impact on their health. So if we can use behavioral science without nudging them to do the right way, we can actually blur the boundaries between devices, software, and people, and start using intelligent solutions to nudge people in the right moment when it has the most effect. Really powerful. And all 4 are based on a foundation of data science. So I don't actually think we can address the problem without a multidisciplinary approach. And I know we can't address the problem without building the right coalition of value proposition for payers, providers, and health consumers. So it's a super complicated problem, that requires a whole different mindset, to Liek's point, to even begin to address.
No, I love that. I mean, yeah, no, let's get Sukanya, because Blue Cross Blue Shield, not only Massachusetts but in other areas, I for a long time trying to innovate in many areas, successful in some, I still like learning in others, but it's a traditional company, So when you comment about all these areas that, as you said, Claus, is systemic. I mean, it needs to impact a lot of people. There are a lot of pain, because people need to change not only the way they operate, but sometimes there's another learning curve. I want to get from you, Sukanya, how has been this experience for you? Because you've been trying. I mean, the Blue Cross Blue Shield is kind of like trying to change the model for a while. It's not now.
Yes, I mean, change is never easy. We all know that. And Blue Cross Blue Shield of Massachusetts did drive a major change, a revolutionary change in the industry over a decade ago in pioneering what we call the alternative quality contract, which shifted the payment model for providers from one which was fee for service to fee for value. And that was quite a major shift at that point in time. And it has been successful. It's necessary, but not sufficient. There's still a lot more to be done to truly realize full value, to deliver on the holistic health that Claus is talking about. Claus, I appreciate the complexities you're referencing of the 3-tier sale. I love how you laid out the 5 sciences. I hadn't heard somebody talk about it that way. It makes good sense. And holistic health, to me personally, is really about physical, mental, emotional, social, spiritual, and financial health. It's those interdependent, mutually reinforcing factors. And so one of the areas that Blue Cross Blue Shield of Massachusetts currently is trying to make a dent, if I can call it that, on some of those fronts is in the application of our work relative to our aspiration to eliminate health disparities. And our equity work is a big area of focus for us. And we've actually developed something called a Magnolia model, which is really a framework for understanding all the various levels of systemic bias that can influence any given situation. And we're trying to apply that lens and that thinking to how we deploy interventions, including how we might pay providers differently. And we've made some public commitments on that. And so to your point, Claudio, about change being hard and how it's hard, especially for traditional incumbents, to shift, I absolutely agree. And we can't underestimate that. At the same time, I think what can be powerful is when we can tap into purpose to help overcome fear. And so, for example, on this front of equity that I just referenced, the organization has rallied around that. And there is a lot of momentum around that. And that makes it easier to talk about doing things differently. And then last, I just would love to comment on Liek's point on mindset. I think it's a really powerful point. So much of it is what happens. It starts with us all inside, right, before we can do anything more. And I do think it's about reframing the problem, as Claus said. I also think it is about shifting to more of a growth mindset and recognizing that if we want to grow the pie, we have to think differently about even how we interact with others in an ecosystem. And it's less about elbowing others out, and it's more about how we can work together. And in order to do that, that requires building trust. And that requires being able to align on a shared purpose and a shared vision. And that requires aligning incentives. And given the complexities and myriad complexities, as Claus referenced, just the 3-tier sale is just scratching the surface of all the levels of complexity. There's tightly regulated, a whole host of other factors. It becomes really important because for an ecosystem to work, especially when it's multiple parties involved, if there isn't that clear alignment of incentives and trust, it's almost nearly impossible to get things done because we don't all have one brain. If you all have one brain, you can kind of direct everything that's happening. It's all good. But when you've got multiple brains, it requires a different level of coordination.
Lieke, a question I have for you, Lieke. I mean, as an outsider looking like for many clients that you have in other companies, what is the I mean, there is this huge shift from competition, direct competition, and collaboration in an ecosystem. What you have experienced? What is there is the mindset perspective, but what else? What else here?
Yeah, so just to clarify our background, we make sharing marketplaces. So we create digital environments that healthcare organizations use to create transparency on supply and demand of all kinds of goods and services, equipment, to trade between each other or just internally within an organization to make better use of all the capacity that's already out there. And we started this in 2012. And then the circular economy, because it's part of the circular economy, it was still very, very young. And we've been on a missionary more than building a company, actually, for like the first 6 to 7 years of our company. We hardly sold anything. We were just speaking about the why and why it is smarter to share and to collaborate rather than the everyone for themselves mentality that we've inherited, of course, from this industrial time. And then the crisis happened. And all of a sudden, it became so clear that this everyone for themselves mentality has made us so vulnerable. And we saw that there was demands and requests on all kinds of platforms and media, and they were not finding each other, and they were still depending on the informal network. So if you had a sister who knew a guy who had some extra gloves, for example, it was still this informal practice. So that's why we created, for example, a nationwide platform for the Dutch healthcare system, hospitals, but also the long-term care, because they were excluded in the governmental organized help initiatives. They were focusing on the hospitals mainly because, well, they're bigger, they have the biggest mouth, so they were in front of the rows. But the elderly care and the disability care, they also needed PPEs, and they were kind of left out. So we created one platform where everyone could find each other. And all of a sudden, transparency and collaboration were the most logical thing to do. So we created this platform for the time of crisis. Outside crisis, it's a beautiful vehicle to stimulate collaboration, reduce healthcare costs, and work more sustainable. But we always said when there is a new crisis to hit for whatever nature, we have something else, and we are based in Europe. So now, of course, we have the situation with Ukraine. And now we are using this platform for help organizations to advertise the things they need so that we can actually ask all these hospitals, this is what they need. Do you have it? Because then we can have very targeted aid to the right people, to the right place. So again, it shows that one place with the value of wanting to collaborate and create win-win situations is very effective in creating a dent, like Sukanya already said. Yeah.
Yeah, curiosity that I have for you is you have the COVID crisis, a lot of interest, like new technologies that could solve problems that were created because of the pandemic. How is that now that it's kind of like the pandemic is getting off, is getting out of the way? So do you still see like interest for collaboration, or how is it?
Yeah, so actually the pandemic has spurred or catalyzed that mindset change, because when we launched the marketplace, it was already far into the pandemic, and the reaction was actually from national newspapers, for example, how is this new? Why was this not here 5 years ago? And you can imagine my frustration, doing this missionary work for all these years. But I'm actually glad that this is now the reaction, because it means that this mindset change has actually gone a long way already. So we are getting there. So now the organizations are using it, what we meant it for, to save on procurement costs, because buying something from someone else or renting it in is much cheaper. Or they can actually earn something with what they don't use anymore. I don't know how it is in the US, but here in the Netherlands and in Europe in general, there are quite strict targets for healthcare on reducing your CO2 carbon footprint. So it greatly helps with organizations that have to prove that what they are doing.
That's really interesting. I'll
Yeah.
get more on that later. Yes. So I want to go one level down, that is going to management, because I mean, you're commenting about specialization, and you now have like how you can leverage the integration. I think you comment, Sukanya, about there's too many solutions out there, and people are like, I mean, what we do with this, So so many things to tackle and to integrate. So what's changing management? I mean, what that change in the way the traditional healthcare system is managing their operations, their people, their experts. So, Claus, we can start with you and go to Sukanya.
That's a fascinating question. I'll jump off from Sukanya's comment about purpose, because purpose actually drives how you set up your operating model and how you end up managing whatever resources you have and manage your relationships. If you look at our purpose, I'll just take us as an example. Our mission statement is to empower people, all people everywhere, to live their healthiest lives by transforming the healthcare experience. It doesn't say give everybody virtual care, right? It doesn't say replace the existing system. It says help people live their healthiest lives. If you start with that, and then you ask the question, what is the set of things that you have to do from a resource and management perspective, you get to a different place than if what you started with was treat people. And the place you get to is answering the question, what can I do to help people live their healthiest lives? So let's take an example. Right? 80% of the healthcare outcomes are probably derived from, and I'd say it's probably more than 80, right? From primary care, from chronic condition management, and from mental health needs. Like those three things together make up a huge chunk of what needs to happen. So if it was possible to deliver a more holistic, integrated experience just along those three, because if you try to boil the ocean, you'll never be done. That actually makes a difference. So management systems change according to the problem you're trying to solve. Right? Our problem, help people live healthier lives. Our scope that we decided to apply from the perspective of where do we start, chronic conditions, primary care, and mental health. But under a headline that says, and we know because the purpose is help people live their healthiest lives, we have to work with the rest of the system. So what I back my way into is the management systems, the operating models only change when you have that kind of clarity of thought. You only build the right partnerships, you build the right supply chain, you build the right relationships, you build the right orchestration, and in some cases, you acquire the right pieces if you know exactly what you're trying to solve. And when you're operating inside a cooperative mindset that this is a collective problem, that's when we start building management systems that meaningfully change the equation. If we were trying to compete with the payors or the hospitals or the employers, we would never in a million years succeed. Right? That is not the answer. We have a collective generational problem. We have a 100-year at least old problem, and it's time that we solve it together.
No, that's great. That's great. So I think, I mean, this point of purpose, and I see, Lieke, your company was created by purpose as well. I mean, make a huge shift if you manage that well, and that, as you said, that needs to be reflected in the way that you establish, like your incentives, KPIs, or anything about management. I want to see your experience on this, Sukanya, even based on what you said, like how Blue Cross Blue Shield was pioneering before and create more value through the chain, and not like focusing in the traditional way, but focusing in the impact on the patient. So how is that being shifted? Like how management has changed at Blue Cross Blue Shield?
Well, what I would say is, when you're trying to do new things as an incumbent, typically you're trying to both sustain the ways in which things have been done, because many of your customers are still expecting that, and your talent and teams are hardwired for success in that. And you're simultaneously trying to also find ways in which you can do something really different. And oftentimes doing something really different requires a wholly different operating model, to Klaus's point. And so I think in some respects, the challenge, especially for large incumbents, is how do you have both? Some people talk about the speedboat next to the cruise liner and all this, there are many different analogies. And I think, just to bring it down a couple of levels, what I would say just concretely in terms of what it might mean for individual associates who work in these organizations is, kind of akin to the point we were talking about earlier around specialization. The work that gets done, the governance model, the ways in which people operate in the traditional sense typically follows pretty straightforward swim lanes, where it's clear what you're meant to do, you do it very well. There's very clear demarcation lines, if you will, with other parts of the business and other parts even outside of the business. When we're talking about doing things differently, when we're talking about new things, for example, what I just referenced on the equity front, then we start talking about boundary crossing. Then we start talking about more cross-functional initiatives. Then we start talking about cross-functional, multifunctional teams working in more of an agile way, and in many ways, discarding the old way of working. And so currently we have both. We have the model which we need, frankly, to sustain ourselves and be successful in delivering on the goods that are being requested to meet our members' needs, our customers' needs, our providers' needs, and we need to do that efficiently. As well, we have initiatives around equity, consumer experience, another good example, which cuts across different parts of the organization. And so we're having to tackle that in a different kind of way, organize ourselves in a different kind of way, incent that in a different kind of way to be able to deliver.
Yeah, so interesting. So, Lieke, what would you want your clients to change? I mean, you have you need to integrate this. You have this perspective of talking to so many players, I suppose, and they are collaborating somehow using your platform. I mean, what they should change to be more effective in using your tools and using this collaboration that you offer to them?
Sharing mainly interferes in the procurement process, I guess. If you would have to find one process in an organization, it's probably most likely that. And the most easy way to order and buy things, of course, now is to just go to your ordering portal or your software and do your thing. And then you know that it's going to work. So now we ask them to go to a different place and see if someone else has it available. So what we see that some organizations do, if they have an internal sharing marketplace, is that they make a new policy. So if you want to buy something, you have to go to the sharing platform first and see if a colleague has it somewhere else in the organization, or if someone else outside the organization has it. So that no. And then you can tick that box. If they don't, then you go through your regular process. Top-down helps. So top-down pressure, but it's not my favorite way. I prefer to have a bottom-up movement where people just experience the advantage and get so enthusiastic about what it gives them that they start doing it. And to give you an example, we have a platform for pharmacists in the Netherlands. And they use it to exchange medication approaching the expiration date. So this is typically expensive medication that was ordered for a specific patient. That patient dies or moves or doesn't respond well to the treatment, so they change. And then that medication remains in the pharmacy because it can't go back to wholesale. They won't take it back. So, but it's not something you give out to someone else next week. So it sits on your shelves and eventually they have to discard it. Now, you have to imagine that the medication production process is number 3 most ecologically hazardous processes in whole healthcare. So saving every medicine from unnecessary destruction, that's really helpful. So we started this, but it's actually illegal in Europe and I think in the US too, because you can only sell medication if you have a wholesale permit. But we started it anyway, although it was illegal. We did it below the radar We got huge success with just 20 pharmacists. We saved more than 50,000 euros in just 6 months. Then the ministry actually awarded us a prize for most sustainable healthcare worker. And then the next week we got a call saying, but guys, this is actually illegal, isn't it? So, but then we were at the table with the right people to have the discussion that we needed to have, because previously they had not acknowledged there was actually an issue with medication in stock. So then we went through a 1.5-year process with health inspection, going back and forward, how we can change our processes so that it does fall within the gray area of the rules. So that they could at least leave us alone. So that's what we have now. We don't sell the medication, but we actually transfer the patient. So the seller becomes the treating pharmacist. So in all this time, we have been allowed by the Dutch Health Inspection to operate, and we've had pharmacists keep signing up, but they were very hesitant to actually do it because they were still afraid to get the inspection on their back. So now that we are in the legal zone, we've seen an incredible increase in numbers of transactions, and we get such positive responses that it is so easy to use. And pharmacists are entrepreneurs, right? They run their little shop, at least here in the Netherlands. They are standalone entities. So if they do well, if they save costs, if they earn money with something that otherwise would have been discarded, it's a direct result for them. So they save 30 to 50% compared to the wholesale price if they buy from a colleague through PharmaSwap. So it's very attractive for them. And now they are getting these first results, and we are really seeing that we are crossing this corner where you have the critical mass experiencing success, and then it starts to spread also in the pharmacist collective. So it becomes a thing. And I think that's what's needed to actually create a change, but it's really hard in this first phase. And sometimes it's so hard that you don't know if it's actually going to work, and you feel like you're dragging a dead horse, is how we say it in Dutch. But only, if you persist, you will know if it's worth it. So that's always the balance. Am I persisting because I'm stubborn, or am I persisting because I deeply believe that there is something to gain here?
Yeah, that's fascinating. I mean, that reminds me the kidney transplant algorithms, that match patients and if they are compatible or not. It's fascinating. Is the size of the opportunity? We are talking about one example here. How many others we can find through the system? So I'll come back to Sukanya. That is, and you getting this example of Lieke. I mean, there is a big piece here that is regulation. That you found Lieke that was kind of illegal, and say, okay, how you solve for that? And you found a solution, but you need to kind of like go around the regulation to find a place. I mean, so there's a big regulation sometimes is a big constraint in this whole process. What needs to change in general? I mean, not necessarily in the regulation itself, but in the approach to regulation, because there's a huge job here to be done as well.
Yeah, it's interesting, Claudio. I would say in the last couple of years in healthcare in the United States, we've actually seen the advent of some more transformational regulation policies, which can actually be instructive and helpful depending on how we use them. So, for example, the data interoperability rules that emerged, in essence, enable consumers to have full digital access to their records and grant access to their medical records, both clinical and otherwise, from their provider and their payer, to other third parties as they see fit, starting with Medicare. And that actually helps unleash a lot of potential in the marketplace, because healthcare in the US has historically had an incredible amount of data lockups, and finally we're starting to get to data liquidity, and that's necessary. We've had so many data silos, everything's been shrouded in data secrecy in some respects. And so I do think in some ways regulation can be useful at times. I think we're at a point in the United States where there's enough recognition of the problems that we're facing that there's a lot of pressure on the government to try to find ways to help solve things like runaway drug prices, as an example. And so I think sometimes when we see regulations come through, it's almost a signal that this is a problem in the industry. our constituents care about it. We know healthcare is, one of the top 3 issues oftentimes in politics here in the US. And you guys aren't fixing it properly, so we're going to tell you what to do. And so in some respects, what we would like to be able to do is preemptively address some of those issues before we are prescriptively told how we should do them, because the problem may be truly a problem that the regulators are trying to solve for. The practitioners in the marketplace oftentimes are able to divine what solutions would actually be best suited to meet those problems. And sometimes regulation, to your point, can become very restrictive.
Yes, Klaus, I mean, Teladoc its history faced a lot of struggles with regulation. It was like one of these groups. Yeah, it was one of these groups that Sukanya was saying that was pushing and kind of like making an example of how regulation could change. I mean, do you agree for her? What would you add here?
I think it comes, the thing Sukanya had it right, and it really comes down to the purpose conversation we had. I mean, what is the purpose we're trying to solve? All regulation usually comes from a good heart. It's just that sometimes regulation is maybe a little bit out of tune, right, with how things have changed. Lieke talked about the fact that things are changing rapidly. The pandemic pushed it. It accelerated trends that probably would have happened anyway. I think in some ways, regulations still haven't quite caught up. Right? There are emergency measures that were put in place, and we operate under them. We need to figure out what happens when the emergency measures expire. Right? A simple example is, it's not just at the national level. There are state level rules about what you can and can't do in terms of virtual care. We're not trying to replace the need to go to a hospital to get care or to your local physician. We do think that having the ability to do virtual first for some things is really important, right? Because what we want to do is give people care that's timely, that's convenient, and then effective. And where 5 years ago, we might have all collectively thought more traditionally, that means going to the right local place, increasingly we understand it's a hybrid care model. We need the regulation to catch up with that shift in what actually constitutes good. And we can't go back to a scenario where there are barriers in place for delivering the right care across boundaries. So that's something I think we have to be mindful of, that regulation is sometimes catching up, right, to a shift that has happened in an ecosystem. If you think about it, what we're really talking about is there's this buzzword out in the industry that, it's all about the digital front door to health. A lot of people who use that word use it as a disintermediate statement. What you've heard all 3 of us talk about today is not that. We're not trying to disintermediate the system. We're trying to make it better. Right? There's still the need for a front door because people need to go to a place and get all of their needs for care met. We invest a lot of resources giving them that kind of experience. On the regulatory side, we need regulation that actually supports that kind of experience, where there is a front door to your health needs, and we have the ability to help people navigate the system. In the end, it's not just about how good we are with clinical science. It's about the experience. Timely, convenient, effective for the health consumers and for the physicians. I'll give you 2 simple examples of choices we have made. It would be far easier and cheaper for us to have our chronic condition management devices be wirelessly enabled than to have them cellularly enabled. But we chose cellular enabled because when you have a young woman, this actually happened, this is a real case. You have a young woman that's a newly diagnosed diabetic driving down the highway, not feeling well. If you're a clinician, you know that when you're newly diagnosed diabetic and you're not feeling well, probably your blood sugar is off. She had our device with her. She was out in the middle of nowhere, right, on the highway. She pulls out the device, measures her blood sugar, it's low. That's a dangerous condition. She's got 2 small kids in the back of her car, and there's no help, right? She's on the highway. But because our device was cellular enabled, we get the data point that she has low blood sugar, and one of our coaches calls her 2 minutes later and say, "Hey, you okay?" Clearly she's not, but she gets the device and say, "Look, Together, we'll find in Google Maps, we'll find the closest gas station. You just drive there, follow the instructions, go in, get somebody to help you get something with sugar in. This is like a sunshine story. It ends well and nothing bad happened. But it was because we had made the choice to not rely on a wireless network, which would not have been there, right, in the middle of the highway. If you take on the clinician side, you can't fly in the expert to a rural hospital in America that's sitting in New York City or in Los Angeles or in San Francisco. It doesn't work that way, right? Because when you have a need, you need to be able to push that presence in. So we built devices that allow physicians to actively beam into a remote location. And we give them high-grade cameras, high-grade microphones. It would have been easier to take a customer, we'll just put it on a tablet. But it doesn't have the grade of camera that lets them see what they need to see. And it doesn't have the grade of microphone. And I keep going, right? We make choices every day as we drive product innovation that are all around how do we give people the experience that actually makes a difference. And if you do it right, Sukanya talked about equity. It's not just about equity in the community, it's equity across the country and internationally. We've had the ability to deploy literally in the span of days or weeks mental health resources to Eastern Europe in current situation. When we had the crisis going on in India, we deployed devices to India so that our physicians or local physicians could get to the villages in rural India. Those are meaningful things that you can only do when you change the equation and focus on how can I create this front door to health that actually meets what people need and isn't tied to or tied down by intrinsic structures that have evolved over a very long time. I'm not trying to replace healthcare. I just want to make it better and more convenient.
No, I love it. I love it. So we are going towards the end here. We have more 3 minutes in the session. So I want to finalize with one question. That is, many players, in all players in the healthcare industry, there are hundreds of subunits, players. Which advice would you give them to join ecosystems? To join ecosystem, to align with an ecosystem, take the opportunity of collaborate in this ecosystem to improve healthcare. So let's start with you, Lieke, and we go Sukanya and with Claus.
That's a hard one, actually. I would actually say just give it a try. Just don't stop coming up with all your obstacles and reasons not to, and especially if it's because usually it's hiding behind conventions and fears. So just give it a try and see how it works for you.
I love it. Yeah. Sukanya, what do you say?
I agree with Lieke. In some ways, it's hard to fully predict and bring out the crystal ball and prognosticate and determine preemptively exactly what's going to be successful and what won't. And so it does require trying things out and learning from that. In addition, I think, we recognize that there are a few different factors that can be really critical for success. One, of course, is understanding whether we're addressing a critical underlying need, critical customer, member, clinician need. And to the extent that you're talking about merging or entering different ecosystems, to the extent that they're sort of merging multiple different needs in a cohesive way, that can be valuable. I think that's one factor. Another factor is ensuring that your vision for what your company is trying to do aligns with that of the ecosystem's vision. And we've talked a bit about mindset and shared culture in some respects and alignment tops to tops. I think that's actually really important. Having a very clear governance and RACI model is really important. Another factor would be having the right incentives in place and really understanding what are the value levers for every party in the ecosystem? Do I understand what they are? And how does my piece fit in? And how can we help reinforce each other? With misaligned incentives, it's really hard to create outsized value. I think another factor is really understanding how you're going to get to scale. And that, I think, is one of the biggest challenges we face in healthcare now. I call it the islands of innovation. We have these islands of innovation, which are beautiful for those few people who are able to make it there. They tend to be disconnected from each other, and most of the action still happening on the mainland, which are the large incumbents. And they need bridges to these islands. And so what's your strategy and your ecosystem strategy to get to scale quickly? Because otherwise we have beautiful solutions that are at best getting a fraction of a percent or single digit percentages of engagement, let alone outcomes.
Great. That's great. Claus, your final.
That's
word for
hard
those
to
that want to
follow
join.
because it was so well put. I'd say continuing the train of thought that Lieke and Sukanya went down, be really crisp on the problem you're trying to solve. The problem we're trying to solve is not a point solution. We're trying to solve a holistic whole care health, whole person health problem. We have to. Right? We owe it to the world around us to solve that problem. Be crisp on the problem. Understand how your part of what you're trying to do fits the bigger problem. The mindset, which is the mindset has to be collaborative. It has to be, I'm not replacing healthcare, I'm making healthcare better. Right? And then it leads to, as you kind of said it well, scale. You can have the best solutions in the universe, right? You can have all the right mindset. If you don't have a road to scale, it's not going to matter. Right? So you have to think into anything you do from an innovation perspective. How do I get to scale? And scale almost always means working with other organizations in healthcare. Right? One of the things that makes healthcare really complicated, and sometimes people say, gee, I didn't know it was that complicated, is that because of the specialization in healthcare that is necessary. It's part of what it means to give people the right care. Scale requires collaboration. It requires that we are trying to amplify and orchestrate each other, not disintermediation.
No, I love it. I love it. I want to thank you all very much. Claus, Sukanya, Lieke, all great contributions here. I hope all of you watching enjoyed the session. Thank you so much.